Hi, I'm Jim Clore. As a part of the Medtronic navigation team, it's important for you to know about the positive impact of your work here. Every day, your contributions to our business improve the lives of patients worldwide. MNav technologies enable innovative surgical procedures that truly benefit those that need them. Your efforts help fulfill the Medtronic mission, help surgeons deliver the best surgical care available, and most importantly, it improves the quality of life of the patients that we serve. In this video, we'll take a look at several patients that have benefited from Medtronic navigation products. We'll also hear from doctors that utilize these products to better treat their patients. In each case, I think you will clearly see that a patient's life has been changed for the better due to an MNav technology that you helped deliver.
Hi, I'm Mary Carey, 69 years old. I have just had deep brain stimulation surgery to correct an essential tremor which I suffered from the time I was a child. First noting it when I was trying to learn to handwrite. Later, as I went on to college, I would be graded down whole grades for professors not being able to read my handwriting. This became exacerbated as the tremor worsened, and most recently, for 3 years, I was unable to handwrite at all, having to rely upon my husband to write checks and to do personal note writing. I was always humiliated and frustrated when in public I would have to sign my name or do anything that required handwriting. I would always have to sit in a restaurant and study the menu carefully, making sure that I could order foods that I wouldn't embarrass myself in eating. As far as entertaining at home, I would frequently be tossing salad across the counter and flipping meat into the back of the oven. So I eagerly awaited the surgery.
So Mary Carey is a patient of Dr. Lieberman and of mine as well. I saw her when I was a fellow, and I saw her with Dr. Lieberman. And we decided, based on our evaluation, that she was a very good candidate for deep brain stimulation surgery. She had a moderate to severe degree of tremor, and she was very concerned about side effects that could happen from surgery. We went through all these side effects, the incidents that are very low, and she decided to go for unilateral VIM implantation. And she had, after the surgery, she had a very good outcome post-surgically. There were no complications intraoperatively. And after the surgery, I saw her 3 weeks, about 3 to 4 weeks later. And she came in for the first adjustment. After the first adjustment, there was more than 50% to 60% of improvement. She was very satisfied. Secondary to this significant response that Marie Carey had, I think her quality of life improved dramatically. I do say that maybe she had an improvement of 70 to 80% in total, and she is able to use her hand in a more dexterous. She's able to write. She's able to drink from a cup with a hand, and she doesn't have to use both hands anymore. So I think overall the success in her case was pretty good. Yes. The deep brain stimulator has it changed my way of practicing neurology and movement disorders? Of course, it provides us of a different treatment modality that we didn't have before it came out.
As a result of this frustration and, in many cases, humiliation, I decided to take the risk, a small one albeit, and have the deep brain stimulation surgery. I had this in May of 2008 in a two-part procedure, and following the second part of the procedure, in which the implant was connected to the transmitter and in my case placed in the abdomen, I came for the activation of the neurotransmitter and realized that my tremor of this magnitude had calmed completely. I was just overwhelmed with joy, and I still feel it today. And there's so many things that I can do now that I couldn't do before. I can handwrite, of course, write checks, which I love to do for the right things, and I can thread a needle. I can wrap Christmas presents without having someone else have to do the bows. I can go out to eat and not have to scan the menu to make sure there are foods that I can manage without spilling. I can serve a salad without throwing it across the counter, and I can turn a piece of meat without having it wind up in the back of the oven. So every day there are new and wonderful things that I find that I'm capable of doing. It has changed the quality of my life so remarkably that I can't express the gratitude that I feel.
My name is George Waba. I'm 63 years old. I'm a PGA professional. In 1968, during the Vietnam era, I was involved in a very severe accident. A 2.5-ton military truck flipped over, and I was injured pretty badly. My head, my back, and my lower body were almost completely, not completely, but they were crushed. And through the years, the military did a nice job. Military doctors did a nice job back in 1969, 1970, putting my back together. But the pain was, sometimes out of reach. My back hurt so badly that I had to take a lot of medication. And I've been going to Fitzsimmons when it was a military hospital, and now when it became the Anschutz Center, I was getting a lot of epidural shots for my back and my shoulder. During that time, I met Dr. Patel, and Dr. Patel and I talked about my back and what we need to do with it. And he kept saying, well, let's think about what we need to do, and we've been talking about it for about a couple of years. The pain was so bad that I couldn't stand it anymore.
George is a patient of mine that I've been seeing for a few years now. He came to me probably about 3 to 4 years ago and had significant back pain for many, many years. He had an injury, I think, back in 1960, sometime in the 60s, and had a bad fracture. And that fracture left him with something we call kyphosis, where he was hunched forwards because of that fracture. We can actually see that here on his CAT scan, where this vertebra has been compressed and collapsed very much forwards, which makes his overall alignment of his spine, instead of having a nice gradual curvature to it, a very steep angulation right here in the upper part of his lumbar spine. And that That's been his biggest problem, and it's thrown his body mechanics off completely. And he's had a number of treatments and procedures that have been attempts to try to control his pain, but nothing has ever really treated his underlying problem that he's hunched over because of the fracture. The decision was made to go ahead with surgery, and the surgical treatment was then to basically cut out that whole chunk of vertebra, cut out that whole piece of bone from the backside and crack his spine so that we could straighten it out. And then once we straightened it out, lock it down with screws and rods to hold everything in place and let it fuse solidly in that much better alignment so that he could function normally. And that's what we were able to accomplish, and a big part of it was having this intraoperative navigation system. This navigation system allows us to do an operation much more safely and much more effectively than we could in the past. Many operations we could never do. And that's probably why when he had his original surgical treatment for this fracture, they didn't do it the right way, because they didn't have the technology to fix it properly. So now, with his alignment significantly better, now he doesn't have to exert so much energy in trying to stand up straight. He can stand up straight naturally, and as such, he can really get back to leading a normal life. He can be fully active again and go back to playing golf and helping his kids with their golf game, I think is what he's been telling me, and really get back to a normal lifestyle, whereas before he was completely debilitated.
My condition now is, wow, 1,000 times better than it was. My back feels great. It's still a little stiff, but with the exercising that I do on a daily basis, I keep everything loose. I keep everything mobile. My back is more stable. It's more functional. I'm not afraid to do things that I was afraid of 10 years ago. When you take drugs for pain for 30 years and all of a sudden you get off of it, you see a different world. I'm back into playing golf. I feel a lot better. I'm, walking more. I'm a little more physical than I used to be. So it did work. It's great. For a long time, I did not want to play because it hurt. And now I'm happy. I'm back to playing golf, and that's what I want to do. And they help me. God bless them.
Hi, I'm Sarah. I am 22 years old, and I found out that I had a brain tumor when I was 19. It was right after my freshman year of college, and I had been kind of sick and not feeling well, and I had a seizure while I was sleeping, actually, and I went to the emergency room and pretty much found out I had a brain tumor, which was a pretty big shocker for being 19 and still wanting to be young and live my life. And at the time it was a shocker. I kind of laughed. I was like, this isn't true, until it hit me pretty hard. And I was really worried that, I'm young, I have to get married and do all that kind of stuff. So it hit me pretty hard. I had surgery a month later with Dr. Nelson, and the time in between the surgery was pretty intense, just waiting, because I did not know. You hear brain surgery and you just think the most invasive thing ever. They're going to go in and ruin your brain, pretty much. You have something that, your brain is the most important part of your body, so it was pretty hard to hear that. But overall, I think that my quality of life before the surgery, it was incredible. And so to hear I had this brain tumor, I was like, how is it going to be afterward?
Sarah was first referred to me back in 2006 after she had experienced a new seizure and was seen in the emergency room up in Longmont and had a CT scan of the brain and MRI of the brain, which demonstrated a small lesion in the left temporal area here. And I recommended that we take this out because of the possibility that this represented tumor. And this would also be advantageous because it would probably help control her new seizure disorder. And so I discussed it with her and her parents, and they wanted to proceed with this. And so on July 5th, I believe it was, we took her to the operating room and placed her in the lateral position, and using a Medtronic stealth station, we were able to make an incision behind her left ear that was linear and very small. It was only about 4.5 centimeters, and planned a craniotomy directly over the tumor itself. Our craniotomy was about the size of a $50 silver dollar, and we were able to plan that kind of small opening in the bone because of the stealth station. Prior to that kind of technology being available, we would have had to make a longer incision, expose more tissue, and then take off more bone, anticipating that the bony opening would not be directly above the tumor, so you had to make a larger opening to ensure that you encompassed the area where the tumor was. The stealth station showed us very clearly where the tumor was, and we were able to make a smaller opening, and the surgery took about an hour, and she went home the following day and has done very well since. Subsequent MRIs since that time have demonstrated no evidence of recurrence, and she's now a very successful college student. And I'm glad to say that she's there with a much smaller incision and a much less impact on surgery on her life because of the Medtronic product, the stealth station.
After my surgery, I was in and out of the hospital in less than 24 hours, which is pretty incredible because I thought I was going to be in the hospital for another week or two, especially because when I found out I had it, I was in the hospital for a week. So the fact that I was able to have a brain surgery and be in and out of the hospital in 24 hours had me ecstatic because I never want to go to a hospital ever again. Pretty much my quality of life didn't really change. It stayed the same, it stayed normal, which I was happy about because I loved my life before and I love my life even more after the brain surgery. It gave me a better perspective on life overall. Like I live life more to the fullest now because for one, when you find out you have a brain tumor, I felt like it was my death wish in a way. So to be able just to have nothing change in my life at all. I mean, I did lose my license for 6 months because of the seizure, but I have that back and everything is perfect now. It couldn't be better. And I have Dr. Nelson and everyone to thank for that. So my life is amazing. I couldn't ask for anything better. I am not really familiar with all the equipment that they used during my surgery, but what I do know is that Dr. Nelson was able to go in and make a hole small enough that it was right over my brain tumor, so it kind of just popped out actually. And I'm so grateful for that because they didn't have to shave any of my hair, which I was going to be devastated about because I'm 19 and all young and loved my hair at the time. And so that was a big deal for me. Also, because I was able to be out of the hospital in 24 hours and this equipment was not as invasive, I was able to go on with my life almost instantly. Yeah, for 2 weeks I couldn't, be out playing football or wrestling around or doing whatever. But I pretty much was able to go out and be with friends and be with whoever I wanted, do whatever I wanted for the most part. So because of that, there was really not a damper on my life in any way.
I hope you enjoyed this look into the lives of patients that have benefited from our efforts here at Medtronic Navigation. Know that there are many more success stories out there, and you can feel proud of the work that you do. Let's keep moving forward as a team to alleviate pain and restore health by delivering the best innovative solutions to our patients and our surgeon customers.
As I sit here now, it is hard to imagine going back to a life that I was leading before. The changes have been profound, rewarding, and I am constantly finding new things that I can do.
The only thing I could say is to the people that put this together, keep on doing what you're doing. God bless you for all the new technology.
So I just really want to thank all of you for everything that you do and for putting all the time in to make this equipment, because it really has changed my life, and not just in me having the brain tumor, but allowing me to continue on with everything that I want to do later in life and right now. So thank you.
Keep up the good work and know that you are changing people's lives in ways that you probably can't even imagine.
So it sounded like they played video games in my back. So I have to get some of that money back from Dr. Patel.